We work in a village primary school in North Wales with about 120 children, including nursery, and our school's always worked on a skills-based thematic approach to teaching. When the National Curriculum 2008 came into play with the skills framework, it suited us greatly as it allowed us to plan via skills and activities even more than we were doing, and the subjects weren't so driven by the knowledge, although that always comes along with the skills-based teaching. To plan the topic, we aimed for upper key stage 2 in our planning. We wrote down everything we thought we could cover, knowing that we wouldn't cover it all. We grouped it all. We broke it down into key questions and decided that the topic would be driven by key questions. We planned activities for each key question to meet the needs of year 5 or 6 children. And we looked at coverage of national curriculum subjects after that to make sure we covered everything we needed to cover and which activities dealt with which aspects of national curriculum. Our planning evolved as we went along and had to be changed because the direction the children took the project, because they exceeded our expectations and we found we could take them further, or because at certain times they didn't get something and we had to move back and cover some work from before that.
I teach a year 3 and 4 class, and although I followed the same key questions, I adapted most of the activities to suit a lower key stage.
In my planning I stuck with the key questions, particularly with the year 5s, but then I differentiated for year 4s and followed a less structured approach.
I teach a year 6 class and decided that the health centre project was going to be a whole term, all-encompassing one, where the children formed groups and companies to design and build a health centre, an ideal health centre. We began the topic by discussing how do we keep healthy, and we looked at all the different areas of good health, food and exercise, well-being, medical things, all the different areas. And then we looked at how those could be delivered within a health centre environment and gave the children the opportunity to decide what things their health centre would need. They formed companies, project management companies, with company names, company logos. They designed questionnaires and surveys to send to parents to find out what the health centre would need. And gradually, over time, they built up to drawing floor plans, which they drew, first of all, roughly, then they drew to scale, then they produced on the computer. We did lots of measurement work, scale work, we did area, perimeter. The floor plans became very detailed, and they had to be juggled around to fit in everything they needed to do. Then we did some work on healthy eating and the balance of good health, and they then used those skills to design a menu and a cafe. Looking at that, we did some work on exercise. They then used those ideas to build and design their gyms. Everything we worked on, the children then brought into their health centre designs. We looked at eco-buildings, and they brought those into their building to make sure their building was eco-friendly. The whole project culminated with them having to present their designs and win the bid to build the health centre, which they did on an evening to parents, all very professionally dressed with their PowerPoint presentations.
With my year 3 and 4 class, we started at the beginning looking at what would go in a health centre, and then we worked our way around a health centre. So we started in the medical area, which would have had doctors, dentists, x-ray, which allowed me to cover most of my science. We looked at the bones and teeth, but we also brought in work like designing a poster or a leaflet for the waiting rooms. They did wax resist x-rays. We then moved on to the cafe, where we looked at balance of good health. They made healthy smoothies and wraps that would have gone in the cafe. We moved on to the sort of sports zone. We looked at the effect of exercise on our bodies and the different types of exercises, and we looked at the heart.
With my year 4-5 class, I followed the key question structure. I put them into year groups, so I had all the 5s working in different groups for the year 4s so that I could extend them. We looked first of all at the structure of the building so that the children could work out the different areas they would need, for example, a gym and a cafe, and then looking at each of those different areas brought in why they would need a gym. So we looked at exercise, we looked at healthy eating for the cafe. We also put in cross-curricular links, looking at the furnishings, for example. We brought in our design and technology project to design chairs. We also brought in things like maths with area and perimeter for working out the sizes of the rooms.
This particular topic covered and stretched the children's thinking skills incredibly, and it focused particularly the minds of boys, groups of boys who normally don't work very well together, and our ALN children flourished working in this way. Using developing thinking skills was much easier when we used activities and resources on the interactive whiteboard or on the computer, because it's much easier to do a pyramid ranking activity or an odd one out or sequencing when you've got a resource where you can just talk with the whole class and move things around. It can be easier than post-its, although you give them post-its to work in smaller groups afterwards and develop those skills at a later date. ICT we used to actually produce a lot of the work the children did, but also to help teach them their skills, and it certainly did impact on them in a way that made their learning just so valuable this year. And I've seen a huge difference in my Year 6s this term based on the work we did last term. You can give them ideas and they just run with them, they're just doing them. They've exceeded my expectations again this term and some of the things I've asked them to do, and I think it's directly down to the way we worked last term.